Let's get back out on Google Hangout. Let's go back to our old friend, Lisa Zamoski. She is a health journalist. She works for WebMD, the LA Times. Thanks for being back. And we always appreciate that, that national perspective you give us. So I just want to ask you right out of the gate here, does it matter, is where you live, does where you live play a role in this marketplace and how it will work for you?
Yeah, so as I think some of your guests are talking about earlier in the show, it does matter in the sense that if you live in a state not running its own marketplace, as you do in Missouri,
right.
It will be run by the federal government. And there are other states that have chosen to run their own marketplace. And as I'm sure many people are aware, there's been a lot in the news lately about the fact that the federal marketplace, in particular through healthcare.gov, has had a significant amount of problems in terms of allowing people to sign up for coverage.
Different results at the state level?
Different results at the state level. There certainly have been some glitches around the country as well, but generally speaking, we are starting to see some much higher numbers, smoother operations in terms of people being able to sign up. Just here in my home state of California, for example, there was a report out by Covered California yesterday, which is our state's marketplace, indicating that just about 95,000 people have been able to start filling out applications. So that's significantly higher than what we're seeing on the federal level just here alone.
In your reporting, are you seeing things like we just heard earlier in the show from Greene County, Missouri, our southwest corner of Missouri, where are some communities doing more than others and getting involved like that? Are you seeing examples like that?
In terms of educating the population?
Absolutely, yeah.
Yeah, I think that, around the country, we certainly see that there are generally states that have embraced health reform, have decided to expand Medicaid, have decided to run their own state marketplace. In many cases are also making a fairly significant effort to ensure that their population is educated, that they know how to sign up, where to sign up, and the new benefits available to them. There are other states that have been vehemently opposed on the opposite end of the spectrum to the law, that in some cases have actually taken active steps to thwart efforts to educate the public, and then anything in between. So it really, where you live really does seem to matter in many respects. Yeah.
What are you seeing in terms of that education level? I making the rounds on the Facebook and the YouTube was our friend Jimmy Kimmel, the late night comedian, at the expense of unsuspecting folks on the street. He was asking them, do you prefer Obamacare or the Affordable Care Act? And they thought they were two different things. And that's that's easy to laugh at from the comfort of your couch. But what's the education level that you see in terms of around the country?
Unfortunately, I would say that while I, like everybody else, did chuckle at that, I was not wildly surprised. The education level, the understanding of the law is not great. Having said that, I answer questions through online live events and every day for WebMD, for example. People can log on and ask me questions about health reform, and I am starting to see people ask more informed questions, starting to understand a little bit, particularly getting a little bit more in the weeds as the marketplaces have opened in terms of how they go about doing this. But generally speaking, and I think also because the law has been so politicized, there's been so many different messages and misinformation, people are really confused.
So what are the questions you're getting? What are some of the most frequent questions you see, and what would you like people to know? What's your takeaway here tonight?
I think some of your guests have touched on this earlier. Undoubtedly, one of the most common questions I get is, if I have Medicare, if I have work-based coverage, do I have to do something? Do I have to give up my insurance, or should I be shopping on the exchange? And the answer to that is absolutely not. Medicare recipients not only do not need to go on, they are not allowed to be sold in a new plan on the marketplace. It is not. It's something that Centers for Medicaid and Medicare have said they do not. It is illegal for insurers to do. If you have coverage now through Medicaid, Medicare, TRICARE, work, generally speaking, this is not for you. And people are also concerned about costs. What if I don't make any money? I don't have any income. Am I going to be penalized? And the answer there again is no. First of all, there are a lot of subsidies available to help people afford coverage. And if you truly cannot afford it, for example, if the lowest cost plan is more than 8% of your income and you live in a state like Missouri not expanding Medicaid, he will not be held accountable for having coverage or for paying a penalty. So there are exceptions, and people are concerned about those.